All right, first of all, I'm gonna check if the scene is safe. The scene is safe. There's no hazards. I got my PPE on. First thing I'm gonna do, hello, my name is Declan. I'm a student athletic therapist. Can you tell me what's going on?
I'm feeling a little dizzy.
You're feeling a little dizzy. Okay, my patient is aware. I'm gonna check off LOR. What were you doing prior? Were you like doing contact sport or whatever, or just jogging around?
Yeah, I was just doing some sport.
Just jogging around, right?
Yes.
Like some passive sports, no contacts. Do you hit your head by any chance?
No.
Okay, I'm gonna clear SMR. My patient's speaking to me, so airway and breathing is clear. I'm just gonna check your radial pulse. Is it okay that I... Nice and strong. Okay, next up, I'm gonna put on SpO2 so I can get some vitals on you later. You're right here. Thank you. I do not need an OPA because my patient is conscious at the moment. ABC is already cleared. I'm just gonna do a RBS or rapid body survey. What it is I'm going to tap around your body, see if there's any liquids or anything, any deformity protruding out. Is that okay?
Yes.
Do I have your permission to assess you?
Yes.
Okay, I'm just gonna quickly tap, 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 and tap. Okay, I do not feel any bodily fluids or liquids or any protrusion or deformity. RBS is cleared. Is this the most comfortable position for you?
No, I feel like laying down.
Laying down? Okay, let me help you. I'm just gonna support the head. You can lay down. Yep, slowly. Thank you. Okay, I'm also gonna put a BB cuff on you just to get more of your vitals in a bit. However, I have to put it the opposite arm of the arm that I put your SpO2 on. So I'm just gonna put it here. I'm gonna place it right. Get it down where your artery is. I'm gonna break your artery right here. And I'm gonna bring out my stethoscope. Where's my stethoscope? Right here. I'm gonna take your vitals after I get some important questions out of you, okay? All right. As in the moment, patient positioning is cleared. EMS, I'm gonna hold off that decision for a moment because I have no idea what's going on yet. So I'm just gonna ask you some questions, okay? So can you tell me like your main signs and symptoms? How are you feeling at the moment?
I'm just having some trouble breathing and I feel a little dizzy.
Okay, trouble breathing and feeling dizzy. Do you have any allergies?
Yes, I have a peanut allergy.
You have a peanut allergy, okay. Do you take any medication?
Yes.
This?
Right here.
Is this your EpiPen?
Yes.
Okay, so do you remember if you had consumed any nuts as a recent?
Not that I know of.
Not that you know of. What do you eat last?
I had a granola bar.
You had a granola bar. Do you have the covering of that granola bar anywhere?
Yes.
Okay, where is it? Somewhere here. Okay, I'm just gonna take a look at it. I'm gonna take a look at the ingredients. There's nuts in here. Okay, so your last meal, your past history. Have you ever had a reaction like this before?
No.
No? First time? Okay. I'm just gonna call EMS right away because I have a suspected anaphylactic shock. So I'm just gonna get someone in the crowd, or if there isn't, then I'm just gonna pick up my phone. Hello, can I get EMS? I have a suspected young healthy male who just gone into anaphylactic shock, so no longer healthy. But I'm going to administer EpiPen. So patient is responsive, having trouble breathing, and is a little bit dizzy. Okay, I'll put the phone on the side. I'm gonna name 6 routes of medication. I'm gonna read on the EpiPen. Is your name Eden?
Yes.
Okay, I need to know the right time. The right time is you're having anaphylactic shock. Documentation. I just have to confirm with you, is this your EpiPen?
Yes.
Okay, right dosage, it says here 1 dose per use. Right route, I have to administer down the thigh, and medication is an EpiPen. Okay, so I have to document time as well. Right now, time is 1:00 p.m. So I'm just going to take the cap off. I'm gonna administer it. 1, 2. I take it off. I write down time. Okay, I'm just gonna rub the site of entrance for 30 seconds. While I do that, I'm gonna ask you a few more questions. What is the onset? Do you know like how suddenly it happened? Like did it happen like maybe 5 minutes ago? It just came on really suddenly?
Yes, it came on quite suddenly.
Quite suddenly? Okay. Is there anything that makes you feel better or worse? Maybe it provocates it. Maybe if you're under the sun, you feel worse.
I don't know.
You don't know? All right, that's fine. The quality, do you feel like this dizzy is like really strong and achy? Like it's like just destroying your head kind of thing? You're not sure?
I'm not sure.
Okay, that's okay. And the region of this uncomfortableness, just in general, all over your body, mostly in your head, right?
Yes.
Okay. In severity, how uncomfortable do you feel right now? From 0 to 10, if 10 is the worst feeling you've ever had.
5.
5? Okay. Time, it was sudden, but do you recall how many minutes ago it was before I came here?
No.
No? Okay, that's fine. As in now, I'm just gonna do some vitals. So I'm just gonna check your SpO2. I'm gonna walk around the patient instead of over. I'm just gonna check your finger. Let's see. Your SpO2 is 98 and your pulse is 66. It's quite stable. I'm just gonna write down. SpO2 98. Pulse rate is 66. Let's get BP. I'm just gonna get my stethoscope. Thank you. $115.65. Let's type this one, right? As the EMS arrive, like it's not arriving, but as it's arriving, I'm just gonna keep monitoring the patient and prevent for anaphylactic shock. I'm gonna check for your skin temperature. I'm just gonna put the back of my hand onto your forehead to check for your skin temperature, okay?
Okay.
It's going cold and clammy. My patient might be going into shock. So I'm going to elevate his legs, please. Right here. I'm going to put a blanket over him to prevent for shock. Ideally, I would want to elevate his legs above his chest. However, I don't have something of that high for the moment. And it's okay, I'm just going to put my hand here to continue assessing. Twelve breaths a minute. That's still borderline stable. For now, I'm just gonna keep monitoring for the patient's vitals until EMS comes and try and get more information if there's anyone who knows, who's associate of my patient, and that will be it. Thank you.